Welcome, everyone. Today's roundtable focus is all about finding that ultimate comfort and helping you discover new paths to feeling great. I'm so thrilled to have my expert at our table today, Kristen Carless. Kristen is not just a highly qualified physical therapist, but also the co owner of Precision Physical Therapy and Wellness right here in San Luis Obispo. She is a doctor of physical therapy and a board certified specialist in orthopedics, which means she's basically a superhero when it comes to understanding how our bodies move or don't move and why we might be feeling pain. Her clinic focuses on getting the root cause of pain through movement based evaluation and treatment. So, Kristen, welcome.
Thank you so much. I'm so excited to be here to share some of our knowledge about how to get people healthy and active.
Yep, we are all looking forward to it.
Yeah.
Your clinic's motto, "It starts with movement," is so powerful. It's it implies that for someone who's stuck in the chronic pain cycle where movement feels like the enemy, you have to convince them that moving is actually their secret weapon to finding their chill again.
Yeah, I think the main barrier can be people's fear of movement. And I think educating patients, clients on how to move correctly in those really painful phases, but that our bodies like to move and need to move to keep healthy. Bed rest typically does not show improvement, and we need to find ways to be active and healthy to create a nice, healthy lifestyle.
That is wonderful to know. And so, beyond the physical, the muscles, and the joints, how do you see psychological and emotional aspects of chronic pain influencing a patient's recovery?
Yeah, I think so much of our identity is wrapped up in our physical abilities. And I'll see this with college athletes when they graduate from school and their career in athletics is over. They have a really hard time, even without injuries, moving on with life because they're so strongly identified with being an athlete. And I think that carries over into your everyday athlete, someone who just likes to walk every day. If they don't have the ability because of pain or limitations, I think it can really impact their psychological status and their emotional well-being.
So, how do you unravel that? How do you get them to, break out of the emotional barrier or psychologically?
Yeah, I think showing them that exercise or movement is good and that it feels good. I think sometimes it requires a little coaching from the provider to show them what's safe and that they can get back to their goals. And I think that it might require coaching at first, but I think once people see it happen and that you can move and feel good, that people then buy into it and continue to maintain that.
Okay, so that process, it's normal to feel pain and then work through it, and then you can feel good again with movement. Is that kind of the
Yeah.
normal progression?
Yeah, and I think understanding your anatomy and that our bodies are resilient and can go through a lot of change and kind of circle back around and adapt in positive ways, just like they might have made negative adaptations that caused an injury, our body can also be resilient and make adaptations in a positive way to help us become more active and reach our goals.
Okay, so on the average, how long does this change take?
Yeah, some people change on that first visit. They just needed to be told that it's okay or safe to move because they've just been so scared and they didn't know what to do or what their body was capable of. And some people who have more chronic disorders, it might take weeks or months because they've, been so hindered for so long that it's hard to make those adaptations in the brain as well. So it could happen in one visit, and some people just take a little longer, and it kind of depends on the patient's fear. And some people are more anxious about movement than others. So I think it just depends on the person. But I think the more they see that movement feels good and makes
Yeah.
positive changes in their body, I think the more buy-in and then they see the change.
Okay, so that first step is going to a professional that can help you right? Work through that painful initial, okay, okay, that is really good to know. So, what are some practical strategies you use to address that crucial mind-body connection?
Yeah, I think the education component comes back into play because they are understanding what's happening in their own bodies. And I think, we take maybe art history class and we take all these other classes, but we're not given a lot of education on just health and anatomy. Unless you're going down a path of a healthcare provider, I think a lot of people don't know what's happening in their bodies when injuries happen or just on a normal day-to-day basis. And I think just that education of like, this is what my anatomy looks like and feels like, and this is what happens either when an injury happens or when a movement happens. And I think just that understanding gives people a little reassurance because they know what's going on inside of them.
Wow. So, education, do you educate the people right in their sessions, or do they go home with some homework to learn more about their bodies? How do you
I try
educate?
to educate. Yeah, I try to educate people right in the session with me, whether, if they're a visual learner, kinesthetic learner, I might have them make a movement that hurts, and then I do some manual techniques or do some exercise with them, and then I retry that same movement, and then they can kind of see that correlation from pre and post test types of positions. Some people are more visual and they want to see an actual spine or they want to see a model of the hip, and I'll take them through the anatomy and what's happening in the joint when certain movements are happening so that I can tell them why we're going to try certain exercises or certain manual techniques to get them to feel better. And I think when it makes sense to them because they're seeing it, then it helps them buy in and comply with the program that's put in front of them.
Yes, that's great. It's you offer a comprehensive education and it's hands-on.
Yeah,
So you can experience it naturally. You're more prone to want to keep going with that.
yeah, exactly.
Okay. And then are there some at-home strategies for self-management and pain reduction that empower your patients so they can keep feeling good outside their physical therapy sessions?
Yeah, I think it depends on the person and it can range from a very structured program. Some people want it, I can only do 15 minutes every day, and I'll have to give them a very structured, here's one, two, three, four exercises that they do every single day. And some people, it's a little bit more free flow and they just do what feels good in their body, just knowing that movement is really crucial to maintaining a healthy lifestyle for them and to age well.
So when you mean movements, what are some that you really recommend?
Yeah, so anything from strength training to cardiovascular exercise and moving with some intention and intensity. There's great stretches that you can do to kind of mobilize all your body at the same time and feel good just to kind of get out of bed in the morning. So it can kind of range in a lot of different needs depending on the patient.
Okay. So in other words, the at-home strategies is going to be movement that feels comfortable to the person.
Yeah. Mhm.
What if someone is very limited in their movement because of maybe multiple surgeries and not being active most of their life? Like what kind of movement would you suggest they do?
Yeah, I mean, it depends on what surgeries and what their history might be, but I would say start small. Start with either a recumbent bike or a walk for just 5 minutes, and then tack on another 2 minutes the next week, and then another two, and then slowly build over time. Because let's say you go for a walk and it aggravates. Well, you only did a 5 minute walk, so you can always remove time, right? And it's easy to do that. If you start small and grow that way, it's relatively low risk and it's probably not likely that it's going to injure someone in a way that they can't undo.
Okay, so it's not intimidating.
Yeah, yeah.
Okay, so is there one simple movement or stretch that almost anyone can do right now to invite a little more chill into their day, especially if they're feeling stiff or achy?
Yeah, there's a great exercise, and I can include this in my handout later. It's called a quadruped rock. So you'll be on all fours. And then if you've ever done yoga, it's you go from child's pose and then you go forward into a cobra pose. So you kind of rock back and forth and hold each position for about 10 seconds. And it's a great way to mobilize your back, shoulders, knees, hips, even ankles get some stretching in there too. And it's a nice, gentle way to kind of keep everything moving and healthy. Obviously, if there's pain, there's ways to modify it, but that's a nice general exercise to keep people moving.
Okay, and what did you call it again?
A quadruped rock.
Okay, a quadruped rock.
Yeah.
Awesome. Now let's amp this up from the quadruped rock to more than one simple movement, more than one. So, how do you empower your patients to become their own movement gurus, finding ways to keep their bodies happy long after their sessions have ended with you?
Yeah, I think it's about finding things that people enjoy. If I tell someone you need to go walk for 30 minutes a day, at this intensity and keep your heart rate at this, if people don't enjoy doing that, they're not going to do it. And that's kind of pointless. So I just tell people find ways to move that get your heart rate up that you enjoy. And it might take a little trial and error of trying different activities to see what they do enjoy. But I think if you like it, you're going to stick with it and you're going to actually do it at the frequency that you need to age well.
Okay. And so, for women who are passionate about wellness and longevity, what are some future proofing tips that you can offer to keep their bodies strong and mobile as they navigate life's next chapters?
Yeah, I think especially for women, and I think this is good advice for anyone, but especially women with hormonal changes, women are at higher risk of bone density issues. I think strength training is a huge component that often gets missed. And I think there's a lot of research that supports not just weight-bearing activities, but loading the joints and bones more than just our body weight. So that includes a lot of strength training and building muscle mass. And I think the research shows that that also helps decrease mortality rates. And going back to that intensity of exercise, trying to get your heart rate up when you exercise frequently, bouts of intensity and that high intensity exercise can be really helpful, not just for our cardiovascular health, our bone health, but also for our brain health and aging with good cognitive function.
Wow, I didn't even think about brain health.
Yeah.
Okay. So, what's something that you do for yourself?
Yeah, I try to get a variety of exercise into my routine. I do high intensity workouts that include strength training and sprint training, and I do tennis and more cardiovascular exercise just on my own, where I try to get intervals in where I can get my heart rate up in intervals.
Oh, that sounds like so much fun. And you have little kids that keep you busy.
Yeah, and chasing after them. And they
So
started tennis as well, so that's fun. I get to go out and play with them now.
oh, okay. And we know your husband is a tennis coach. So you're a
Yeah.
tennis
So it's
family.
a family affair now. Yeah.
That's so awesome because tennis is one of the best exercises, you know, to kind
Yeah.
of keep doing throughout one's life because of the
Mhm.
cardio and the strength and the reaction time,
Yeah.
right?
And
And
actually, the social aspect of tennis,
that's a
I think is a component of that as well. I think there was some research that came out that racket sports increases your lifespan by like, I forget how many years, but there was some research supporting racket sports specifically and longevity.
I think I can believe
And it's
that.
fun.
And it's fun.
Yeah.
Are you have you picked
Yeah.
up ball?
I've dabbled in some
Dabble
pickleball.
pickleball.
Yeah, it's fun. It's a quick moving sport. It's tiring.
Exactly. I know people, I know many people who love it.
Yeah, it's fun. I enjoy it.
You know what? One thing I didn't ask, and I really do want to know is our bodies does give us subtle cues about pain, and many times, we kind of ignore it or we just push it away, thinking it'll be okay, I'll deal with it later. So, how do you coach your patient to listen to those subtle cues?
Yeah, I think it is tricky. I think it's natural to sometimes ignore little aches and pains that come about because we think, oh, it'll go away. And sometimes it does. So it kind of reinforces that cycle. But I do think as motivation for people to tackle stuff before it becomes a more chronic issue is it's easier and faster to treat the sooner you treat it. The longer you wait, the tissue has started to make changes, and then it's harder to undo some of those changes versus a more acute injury can be a lot faster to recover from.
I see. You know what? Let's circle back to education. Because I also think that that piece is so important. Is there a good book that you recommend to your patients, or maybe even one that you're reading right now?
Yeah, and it doesn't necessarily pertain to the pain component of what we've been discussing, but I just finished a book called The Ageless Brain by Dr. Dale Bredesen, and it speaks to a few things that we mentioned, like exercise. Exercise with blood flow restriction can help with cognition, which is kind of like whoa, I still haven't quite figured out why. That exercise with intensity, which could be a 30-minute walk with 30-second intervals of increasing intensity and then 30-second kind of a active recovery walk. It talks about diet, sleep is really important, stress management, brain stimulation, detoxification. So it kind of covers the whole gamut of supplements you should take and things of that nature. And it's a hefty read, but it's a fascinating one.
Are there some highlights that you took away that you are going to apply into your life?
Yeah, I've started using my watch at night to monitor my sleep to see not only how much sleep I'm getting, but how much deep sleep, how much REM sleep, because those are times where our brain makes a lot of recovery. And helps with cognitive function as well. So I'm trying to monitor that. I'm trying to reduce stress, which is not the easiest component. My exercise, I've already done a lot of high intensity training, but it's opened my eyes to blood flow restriction, which is another, we utilize it a lot with our patients here in the clinic for putting less load through tendons while getting more strength gains out of it. So you get more muscle hypertrophy at a faster rate. So it doesn't stress the surrounding tissue as much. But now there's research that shows it can also help with our brain function. So it's a little more enticing. It's an intimidating concept for a lot of people, right? You're kind of putting a tourniquet on your extremity as your strength training. But there's some good research behind it. So I think it's kind of leaning me a little more in that direction personally to see if I want to explore that more. Um, and diet, I've started to change certain things in my diet, adding certain supplements into my world. Not that I'm an expert on it, but I'm trying to kind of use this physician's recommendations to help with my own aging and health as well.
Okay, so may I ask what are some of the supplements?
Yeah. So, granted, I'm not a physician or a nutritionist, but
Personal question.
yeah, I've added vitamin D, which also this kind of pertains to your question about women. Women tend to show a lot of vitamin D deficiencies, and that can have a strong link to dementia and Alzheimer's later in age, but especially for women. And then I've added in creatine monohydrate, which most people think is good for muscle health, which it is, but it's even better for our brain health. So I've added creatine monohydrate in. And then I've added in magnesium for stress
Right.
and ashwagandha. I don't know, you name it. I'm like, just take a bowl full of I have really expensive urine, or I'm going to have a really great brain when I get to whatever age that is.
Yes, because you have mentioned living to 100, but not just that, 100 with good cognition, right?
Yes. Yeah, my family tends to have a very long lifespan. I don't know if that's always a good thing or a bad thing, but several people living well into their 90s and 100 plus. And you see both cognitive function decline and physical function decline. And I'm all for living to 100, but only if my quality of life is still there. And so I want to do everything I can. I'm turning 40 this year. So I want to make
Yeah.
sure I do everything I can to make sure the next half or more is with a good quality, good cognitive functioning, and good physical health.
Yeah, I say you're starting very young. You're only 30.
Yeah, I'm
You're
trying.
already thinking to 100.
Yeah. You got to start now, right?
That's right. Never too young to start.
Yeah.
Okay, so I do want to know what was your path to become a doctor of physical therapy?
Yeah. So I had an injury when I think I was in junior high school. I was a basketball player and I sprained an ankle. It was a pretty easy injury to deal with, but I've always been strongly identified as an athlete. And so it exposed me to physical therapy. And I saw, it's a cool environment. You get to interact with people all day. You get to learn about the body. You get to learn about exercise and how to make people feel better and get back to their life again. I got to get back to all of my sports and went on to play basketball in college. And, those are really important things for people. And I get to help people do that every day. And how cool is that? So, it kind of was that early exposure, which is so rare that people know what they want to do from junior high. I just kind of got lucky, I guess you could say, in that I got injured and then I just kind of kept going and never looked back.
Definitely called at a very young age.
Yeah.
And you did not veer, you just kind of always knew this is what you wanted to do.
Yeah, at first I thought I wanted to be an attorney. Because my grandpa was, and thank goodness I did not choose that path because I don't think I could sit still all day long at a desk. And so that would have not have been a good fit for me. So yeah, I just kind of decided that's what I wanted to do and then got into physical therapy school thinking I wanted to do pediatrics. And then I'm 6 foot tall. So rolling around on the floor with little ones is not really cut out for this body. And you also have to have like 20 backup plans when you work with kids. And that's not easy. But I also really love orthopedics. I love to problem solve and see how can I get this person to move this way without pain or prevent injuries when they're in that position and get to do what they love. And it's kind of instant gratification selfishly. I get to see them move, make a change happen, and then see them move again and see that like their faces light up like, wow, that feels so much better. And it's really rewarding. And I kind of went down that road of orthopedics and never looked back.
Okay, so not looking back, but looking into the future, how do you kind of imagining, how this profession will play out for you?
Yeah, I think it's great to help people recover from injuries, but I think moving forward, I would love to see more people take initiative and not wait for injuries to occur before seeing someone to alleviate it. I think taking action proactively, like by doing exercises, by doing high intensity cardiovascular exercise, is a great way to get ahead of stuff and taking care of issues that arise early. So I'm kind of looking into preventative programming for our athletes and our non-athletes. I think everyone would benefit from that. And seeing people look at it more from a wellness perspective, more so than putting out the fire.
Okay, I love that. So that makes you stand out as a physical therapy doctor to bring in the preventative model and to kind of push that to the forefront. So,
Yeah.
yeah, I think that's wonderful. And I imagine you'll be a doctor of physical therapy till you're 100.
Oh, we'll see. Hopefully I
What?
get to retire at some point and travel and enjoy some time with my
Okay,
husband too.
okay, that'll be great. So
Yeah.
we know you have a amazing free gift for everyone in attendance. Um, could
Yeah.
you tell us what it is?
Yeah, it's a handout that has some of my favorite exercises for the whole body. So, from a lot of injuries that I've seen and things I think can be prevented, it will include some of those core exercises to help with that, and some the like the quadruped rocking, which kind of helps limber up the whole body. So it's kind of a nice, quick and dirty exercise to help with everything. So it'll just kind of be an overall wellness program of some of my highlights and my favorites.
Okay, that's wonderful. So for everyone, it's a PDF. It's going to be downloadable of Kristen's top favorite exercises to keep you staying active and preventing injury.
Yep.
So thank you so much, Kristen, for being with me. This conversation has been truly empowering.
Great. Thank you so much for having me. It's been fun, and I hope, people are inspired to get out there and move in ways that feel good.
That's it. And thank you
Yeah.
to our audience for joining us for the daily dose of 500 milligrams of chill. Bye for now.
Thank you.